Hey everybody, my name is Alexis, and today we're going to be talking about reality shock. So after watching this presentation, you'll be able to define reality shock and identify its influence on nursing and society, identify signs and symptoms of reality shock in the new graduate nurse, and identify programs that are supportive of a new graduate who is experiencing reality shock. According to BusinessDictionary.com, reality shock is the unsettling or jarring experience resulting from wide disparity between what was expected and what the real situation turns out to be, such as the first day on a new job. It is important to talk about reality shock because for almost all new graduate nurses, it is inevitable. I remember when I was about to graduate from nursing school, our teachers sat us down and taught us about the feelings we may feel and how important it is to recognize reality shock. According to Clipper and Cherry, new graduate nurses are likely to have a difficult transition from nursing school into professional practice and often experience a phenomenon known as transition shock, which in this case we are referring to as reality shock. Experiencing reality shock can trigger a chain of events, which we will be talking about at a later slide, the slide that affects nursing practice, healthcare, and society. That's why it is really important to acknowledge the signs and symptoms of reality shock and then provide assistance to the new graduate nurse. As I mentioned on the previous slide, it's really important to recognize the signs and symptoms of reality shock so that we can provide the new grad with assistance. If you notice that the new grad is kind of really reluctant to work independently or they're unable to, they don't perform well, that might be a sign. A huge sign is lack of confidence in their self and in their skill set. If basic nursing skills that a new grad should know from nursing school, but may not be the best at, but if they're constantly voicing feelings of inadequacy, like I can't do this, I can't do that, it may be time to sit them down and kind of see what's going on in their head. Another sign is being consistently stressed and overwhelmed. A huge influence on nursing and the new grad's practice is if the nurse does not transition properly, and the patients can suffer ultimately. If the new grad is consistently focused on their self and being having lack of self-confidence, they can provide inadequate care to their patient. If they also have a fear of their leadership, they may have a fear of asking for help, and which may form a lack of trust, which causes decreased communication, which we all know can cause medical errors. One of the biggest impacts on healthcare and society that this causes is lower first-year retention rate. According to Lukowski and Jones, the way many nurses handle this type of challenge is by jumping ship in their search for calmer seas or greener pastures. This is a huge problem with healthcare and society because it increases the cost to hospitals. It's a high cost to hospitals to keep training new personnel. At LGH, where I work in the operating room, and our training process is 8 months long, where a normal floor nurse is about 3 months, depending on the hospital. We also have to take a peri-op class, and I was told that the cost per person for the peri-op class is $3,000. This is not including the time that they are paying me to actually work at a nursing salary wage. So you can see where this is a huge cost to healthcare, which can increase insurance and the cost of healthcare in a society. And having to keep retraining new personnel and getting new staff means that they're always short-staffed because there's a gap in the training process, which means they don't have competent nurses working on the floor. Being short-staffed can lead to decreased patient satisfaction, which is now becoming a huge issue with the Press-Ganey surveys and insurance. Some hospitals are not being reimbursed as much as they should be if they have decreased patient satisfaction surveys. It also decreases the amount of patients that can be seen if the unit or an office is short-staffed, which creates longer times to get an appointment, which can also decrease patient satisfaction. So two huge solutions that research has shown is forming a structured preceptor training program. This provides the new grad nurses with mentors who they check in with, and some structured preceptor trainings actually have different levels, which helps ease the new grad nurse into the nursing culture. So in conclusion, what I really want to stress is that reality shock is inevitable. It's not something that a nurse should be afraid of, but what's really important is identifying the signs and symptoms. Another huge point is that improper transitioning is a burden to nursing practice, healthcare, and society, as we saw with the increase in healthcare costs. Being proactive and precepting new graduates is important in easing reality shock, and not supporting the new grads leads to a high turnover rate, which increases the cost of healthcare in a society. So here are my references, and I hope you learned a lot about reality shock and ways to be kind and mentor your new grads on your floor to keep them around for a little while. And being a new grad nurse, I really appreciate the mentor program.